Herpes simplex is the topic, and herpes simplex is caused by herpes simplex virus. And there's two. There's herpes simplex virus 1 and herpes simplex virus 2. And the transmission is it is technically a sexually transmitted disease, but what's interesting is that because children can also get it and babies can also get it during delivery, it's really the mode of transmission is really called close contact with an infected person when the virus is actually actively shedding. So it's a little bit of a different distinction, but it definitely can be transmitted during sexual contact as well. Now, what's important about this virus that is rather sad and unfortunate is that it lays dormant in the nerves, and in particular the dorsal root ganglia, dorsal root sacral ganglia. Now, what can happen is that this virus can then be reactivated because of some triggers. So periodically you can get a recurrence of herpes, and here are some of the reasons. A lot of sunlight can trigger this, a febrile illness, stress, physical and emotional stress, and definitely immunosuppression. So for example, someone who has HIV and has a weakened immune system. And that's why herpes is one of those things that just keeps reoccurring, because it keeps the recurrent herpetic eruptions are precipitated by all those things that I just mentioned. So there's three types of herpes infections that I wanted to touch on to give you an illustration of what this is like in terms of signs and symptoms presentation. So the first one is pretty much a lesion, mucocutaneous lesion, and these lesions are commonly occurring on the mouth or the lips or the conjunctiva or the cornea. And what can happen is you have these characteristic vesicles that are in clusters. They kind of look like that, different sizes, like that. And then the base, they're sitting on this erythematous red base. So they describe that as an erythematous base. And I encourage you to look up pictures of the herpes mucocutaneous lesions to get an idea of what this looks like. The second type of herpes presentation is something that happens known as herpes labialis. And there really isn't that much of a difference. It's just technically just given a different name. It's kind of resembles an ulcer or a cold sore, and normally appears on the lip, the area of the lip that a woman would apply lipstick on, known as the vermilion border. Vermilion border. That's the area that this cold sore will appear on. And the last one, which I don't have enough space for, is the most common one, is genital herpes. And that is by far the most common, and in fact it's the most common ulcerative sexually transmitted disease in the world. And basically what you have is on either the penis in a man or the labia in a female, you have the very similar type of vesicles, which is the cluster of small vesicles on a erythematous base. So very similar to the previous description, but this time it's appearing in the genital area. So very important. So how do you diagnose it? The diagnosis really is sort of just characteristic lesions can kind of tell you that, look, this is herpes, but there is definitely some tests. There's a PCR testing, which is by far the most sensitive. It has 95% sensitivity. And this is definitely the best one. It's a definitive diagnosis. Polymerase chain reaction, just in case you're not sure what that is. There's another test that's done that is not as sensitive, but it's very commonly tested or mentioned on licensing exam. It's called a Zank prep. And basically, that's also used in the diagnosis of herpes simplex. But this is the one that's the best one. So you take some fluid or material from the base of the vesicle, and then you test it. So treatment, well, the good news is that for all types of treatment, for all types of herpes, the treatment is essentially the same drugs. Acyclovir is by far the most common, and then valcyclovir is also used. Valcyclovir is more expensive. I'll draw $2 signs here and $1 sign. Actually, let's draw 3. It's quite expensive, but so this is more commonly used. These are antiviral drugs, and they all tend to end in vir, just in case you're wondering. And the viral drugs are great because they reduce the viral shedding. Because remember, when the virus is shedding, that's what's actually causing the virus to spread from person to person when there's close contact. So they reduce the viral shedding. They also reduce the symptoms, which can, in severe herpes, these vesicles can be very painful. And then they also reduce the symptoms, and they also shorten the viral excretion time. So that's some of the reasons why you would use these medications. So now let's take a look at some vignettes and see what this looks like. A 17-year-old white female at 20 weeks gestation presents with a 2-day history of painful vesicular lesions on her labia. This is the first time she has ever had this problem. Her last sexual contact was 10 days ago. She has also had low-grade fever, malaise, headaches, mild diffuse abdominal pain. On exam, she has vesicles and an erythematous papules on the labia bilaterally. A few firm, tender inguinal nodes are also noted. Which of the following tests is the most sensitive for confirming the diagnosis? Well, she most likely has herpes simplex. And because she's pregnant, this is actually a particular concern because this can be transferred during birth, actually even before birth, transplacentally to the fetus, or during birth when the baby passes through the birth canal, because if you notice, the vesicles are on her labia. So if it's transferred to the fetus can have very high risk of problems such as neurologic disease. So it's very important that you treat this. The most sensitive of the tests is PCR. It has 95% sensitivity. Zank test is also used, but it's very low in terms of sensitivity, low sensitivity. So the correct answer for this question is D. Next question. A 32-year-old woman comes to the physician because of recurrent painful outbreaks on her labia and vagina. Her first outbreak was 6 years ago. At that time, she developed what she thought was a bad flu with malaise and fever, along with a painful rash on her labia. This initial outbreak resolved, but since then she has had approximately 8 to 10 outbreaks a year. Each outbreak is preceded by burning in her perineal area. A few days later, she develops vesicles, then shallow painful ulcers that resolve in about 10 days. Which of the following is the most appropriate pharmacotherapy? Well, it's rather unfortunate, and this clinical vignette illustrates the recurrent nature of herpes simplex. And unfortunately, there's no cure, but you can use an antiviral drug known as acyclovir and valcyclovir to shorten the duration of symptoms, and that would be choice A. And finally, big long one. 28-year-old woman comes to the office because of a 3-day history of abdominal pain, fever, headache, and muscle aches. She recently returned from a vacation to Europe where she met a man that she is going to marry. She is feeling so lousy, though, that she is having trouble planning her move. She has been a patient of yours for years and usually very healthy. She is a smart woman who exercises regularly, eats a low-fat diet, does not smoke cigarettes, and rarely drinks alcohol. She has been sexually active over the years with 2 different partners and uses condoms for birth control. She admits that she was not as careful as usual about condom use during her vacation. Her last menstrual period began 3 days ago. Temperature is 37. Physical exam shows numerous vesicles, pustules, and painful erythematous ulcers on her perineum, vulva, and vagina. A Zack smear of scrapings from the lesion shows multinucleated giant cells. A tissue culture isolates herpes simplex virus 2. At this time, the most appropriate correct statement is, well, you've only got 2 to choose from here. Condoms do not eliminate the transmission of the virus when lesions are present. That is actually the correct statement, because transmission by skin-to-skin contact can occur even when a condom is used, because if the lesions are present, the lesions can still, there still can be contact from person to person, even with a condom. Even with a condom, you can have skin-to-skin contact of the lesions. So B is the correct answer. Let's look at A. Acyclovir will shorten the duration of symptoms. That is correct, but not the viral excretion time. Acyclovir does shorten the viral excretion time. So the but not part is incorrect. So that's why A is not correct. So the correct answer is B.